BT's Body in Balance is sponsored by Canada Diagnostic Centres, offering X-ray and ultrasound services in 5 convenient Calgary and area locations.
Imagine feeling really sick, but no one can tell you what's wrong. There are many patients with unexplained symptoms. Our health specialist Leah Sarich is here now with how one researcher at the U of C wants to help these patients and doctors also cope with this frustrating situation.
Can you imagine?
No.
No, it would just be horrifying and really debilitating. And of course, what happens is after a while you start thinking, gee, is this all in my head? You know, and the doctors, you know, they might not make you feel that way, but they, you know, the implication is there often, even though that's not what they're trying to do at all. So Professor Chloe Atkins, I actually interviewed her a couple of years ago for the first time when she was sort of putting out her book, My Imaginary Illness.
I've actually spoken to her as well.
Exactly.
Yep.
So the book is fascinating. So it's about her own journey through the medical system with her own set of unexplained symptoms. And so now she's recovered, she's doing really well, but she's actually researching this area. So there's a team of researchers here at the U of C and a team in Vancouver. And you know, she was eventually diagnosed after many, many years with a very rare form of a rare disease called myasthenia gravis. And so she knows what it's like to go on and on and on without this diagnosis, and it can be very debilitating. They actually have an acronym for it now. It's called MUPS, so it's called Medically Unexplained or Undiagnosed Physical Symptoms. So this is a thing, so this is happening now. So she's researching it, and basically she explains what they're looking into.
What is it like as a clinician when you've tried everything? You know, you have done every blood test, every scan, every sort of tilt table, inversion, I don't know, whatever sort of nuclear scan imaging you can do, and it keeps coming back within normal range, and yet you have a patient in front of you who keeps saying, I feel terrible, I can't do this, like I can't keep going. And so what we really wanted to get was a sense of, well, where do they go when they're at that point, and what do they feel they owe the patient?
So of course that's the doctor side of it, which she's looking into, and she's also looking into the patient side of it. So what does it feel like as a patient to sit there and not have any explanation or not have any diagnosis? And then of course, because the medical system is set up this way, if you don't have a diagnosis, you don't have a treatment. So you're not getting any help, or you're not getting the care that you need or feel you need. So it obviously can be an incredibly frustrating situation. But she also wants to look at what works. So in certain situations, what works? So how do you actually get that doctor to listen to you? How do you get them to maybe take a small risk and try one form of treatment, and how do you make them sort of understand what you're going through and not get that feeling that, okay, maybe it is all in my head. So she's looking at what works as well. So some of the things that she's found so far, maybe there needs to be a specialized clinic that actually just treats people with these unexplained symptoms. So maybe there needs to be a specialized clinic. What also really works is when you have a GP or a family physician that's willing to stick by you regardless. So that obviously is very helpful. And what also really seems to work is strong family support. So again, your family sticking by you regardless of what you're hearing from the medical community. But here's what Professor Atkins hopes to achieve with this research.
First of all, patients are more aware that medicine doesn't always have the answer, and that is acceptable somehow, that they can accept that at some level, and as well as clinicians can accept that, or that the answer may not be immediate. It may take a few years or not. So if we can get sort of a better acceptance of being undiagnosed, I think also if we can develop clinical guidelines for practitioners about what they should do in their practice when they run across this. If we can, we're really looking at the ethics of it. What do you owe to yourself? What do you owe to your patient in that circumstance, even though it's very frustrating?
Of course, what do you owe to everybody, right? Because of course, if you don't have that diagnosis, you don't have the treatment plan, and you know, and it's tough for the doctor as well, because they can't just start randomly treating you. They could seriously harm you. Right? So it's a very tricky line to walk for both doctor and patient. So this research should hopefully help.
And more information on
my blog, and links to her book as well if you want to go through that again.
Really, her story is incredibly
fantastic
interesting.
Story. Yes.
All right, all of that at breakfasttelevision.ca. Health Specialist Leah Sarich, thank you very much.
You're very welcome.